And Mirella joins us now. How are you, Mirella?
Hey, Les, thank you. I'm very well. Thank you for your invitation.
Yes, it's good to see you. So the title of the organization is St. Joseph's Shining Little Stars. Could you tell us a little bit about that organization, what's currently going on with that, and why that non-governmental organization is important to the world?
Yeah. Well, we are a transition home for children under 6 years old in Uganda. Basically, children that has been abused, abandoned, or neglected.
In Uganda, I just want to.
In Uganda, yes, in East Africa. Okay. Uganda has a population about 41, 42 million people. Mm-hmm. 40% of them are malnourished, and the extreme poverty is in the 42%. So I think why this is important is because children are the future, and if we don't do anything, even if it's in a small scale in countries like Uganda, they will never get out of poverty. Right. I think that our project is an amazing project that is based in 3 pillars. So we're not only taking care of the children that has been abused or rescuing them, but if you rescue the children, but families continue to be weak, or the communities are not acknowledging that they have a problem, we're not doing anything. So that's the reason we are not an orphanage; we are a transition home. So our goal is to
take me through the process. How does it work? You identify a youngster who's in that situation. Mm-hmm. What happens?
So it could be that we identify them directly because we visit different villages, or because the government agency that is, basically the probation officer will tell us, this child is in need, will be assigning this child to you, The moment that the child is identified and that, the requirements are met, and the child is admitted, at that particular moment, we start with not only with the proper nutrition, but also healthcare and therapy. These children are maybe a month old and they need emotional and physical therapy. And we have one of the cases, we have a Down syndrome boy that was extremely malnourished. He was only a week old and we almost lost him. I really thought that we were going to lose him. Now he's a 3-year-old, healthy, and there is nothing we can do with Down syndrome, but he will have a better life, because the reason why we focus on children under 6 years old is because that's a window of opportunity that we have. If we miss that with proper nutrition and healthcare and all this, it will be very unlikely that they will ever catch up with their peer group.
Okay, so you're a non-governmental organization. You're a 501c3 organization in the United States. Is that correct?
So in the United States, we have our partner that is Help International, that they meet all their tax requirements in the U.S.
Okay, and so if people donate to Help International,
correct,
can they direct their contributions to assist the St. Joseph's organization, the St. Joseph Shining Little Stars?
Correct, because we have they are like the parent company, the parent organization, but we're totally independent. So fundraising, everything is totally independent.
You're treated as a project.
Correct.
Of their organization.
Correct. In Uganda, we are totally independent, so we are an NGO in Uganda. But obviously, in the U.S., we need their support. And I want to quote this following, that we are independent, but they do all our accounting and all the relationship with the IRS, and they charge us $0 because they also are in Uganda. So the reason why I went to Uganda is because they brought me to Uganda, as I was in my search for my purpose in life. My job was always international, so I was missing that, that contact with other cultures. I decided to leave everything behind. I was working in New York, and after 25 years in the US, I decided that I wanted to volunteer. And when I was in my first trip in Malawi, they invited me to Uganda, and the rest is history. I really thought that that's what my purpose in life. Yeah.
So you love what you're doing.
I love it. Yes, I do.
Tell me what's the most exciting thing that happens during the day for you, and what would be a really terrific thing?
So obviously, there is no way that I can support all the abandoned and abused children in Uganda. But if I can see the life of one child, to have a future, to have an education, to help them be reunited with their families, because what I was mentioned to you before is that our program is based in 3 pillars. One is obviously the children, right? And the second one is the families. The moment that the child is admitted, the families will start trying to rescue the families. Because sometimes they abandon the children not because they are bad people, but because they are really swamped in poverty. I mean, we're talking about 42% extreme poverty. And families
I think, just to interrupt you, I'm sorry to interrupt you, but yes, it's important that that we know that the rest of the world is not the United States. And
correct.
We have no idea what is going on in those places. And people that are willing to steward that kind of effective support are really important, Mirella. And you're one of those individuals, and I commend you seriously. It's a serious undertaking that you've done to help youngsters in Uganda. What would happen to these children if you didn't get involved?
They probably will die. Just to give you an idea of the mortality rate of children under 5, in the US, out of 1,000 births, 5 children will not reach the age of 5. In Uganda, 47 children will not reach the age of 5, just to give you some perspective.
47%.
Right? 47 children out of 1,000 births.
Out of 1,000 births. Okay.
Yeah, in the US, 5.
Okay.
Yeah.
It's 8 times the problem that we have in the United States.
Correct.
And would you say that poverty is the main?
So the main reasons there are several reasons. One is the poverty. I mean, it's extreme poverty. 41% of your country is in extreme poverty. In Uganda, it's extreme poverty. The health system is very deficient. Also, to give you another perspective, Uganda was ranked by the World Health Organization as country number 150 out of 190. So the area where I am, that is in the Busoga area, is 3 hours from Kampala, the capital. I mean, there's nothing there. I mean, when women die by giving birth, it's they die because they give birth in their own home, or not at the hospital, and literally they die by bleeding. And so,
how is that going to change? Do you think that what you're doing will have an influence on changing that overall in Uganda, by having these children be more likely to survive and to become more successful in some way?
Yeah. I think it's obviously when you see the macro, it's like we are just a drop in the ocean. The ocean would not be the same without our drop, right? Mm-hmm. So the third pillar, which is important, that is related to what you're saying, is that communities. So we work with the community and we host workshops in parenting, in nutrition, in hygiene, so they know that what is the problem with the children get infected and how to deal with parasites. I mean, it's perhaps, as I said, it's a drop, but we have to start somewhere. And that's our goal, just to teach the communities, to teach the families, and to rescue the children. These children, by the way...
Yes, go ahead.
when the children are reunited with their families after we have worked with the families in both in this type of workshops, but also in providing vocational training so they can provide with it for their children. When we reunite children with their family, if it is possible, because some children, this is impossible, they don't have anybody, they receive bedding, they receive monthly food distribution, and the most important thing, we pay for their education. That to us is the key to have a brighter future. Is we give them hope, we give them the opportunity for a better life, right?
I can't tell you how much that explanation is the part and parcel of what it is that we're all about in Endow America, in Endowing America, and certainly your organization. If you had all the money that you needed to support yourself from time to time, you wouldn't have to raise money. That would be a big advantage, I'm sure. And that would help you do more work of what the kind that you're doing, Morella. My guest is Morella Carta. Morella is the, I want to get this right, you're the founder and general director of St. Joseph's Shining Little Stars, and you're a project of the, what is the name of the larger organization?
Help International in Colorado.
Help International in Colorado, and people who want to support the work that you're doing, they can give to Help International Colorado, and they can help your project. Is that a fair statement?
Yes, and they can also find us in our website, and if they feel the connection with our organization, they can go there and donate. The best way is starsuganda.com. That's the way to go straight to us. Starsuganda.com. Correct. And in social media, we also are as Stars Uganda.
Fantastic. Okay, this interview will replay on our digital radio station regularly, so people will get a chance to hear about the work that you're doing, Morella. And we thank you very much for joining us on Route 664, the road to human kindness. And you're one of the stewards that can help us along that road. Thank you so much for joining us today.
Thank you, Les, for the invitation.
Absolutely.